warm welcome to all of you. I am Dr. Olga Nishkumai and I am thrilled to host this insightful discussion alongside my esteemed colleague, Dr. Vladimir Chernykh.
Thank you, Dr. Olga. And we welcome you to this European Wellness Health series, where we will dive deep into the world of medicine, diseases and disorders, exploring the latest in their prevention and cutting-edge treatments.
And groundbreaking research in biological regenerative medicine to help you stay informed and healthy. Today, we are turning our focus to crucial and growing area of health concern, Parkinson's disease.
Indeed, Parkinson's disease, or PD, is the fastest growing neurodegenerative disorder globally. Over 10 million people are living with it, and by 2050, that number could reach up to 25 million people. The sharp increase is primarily driven by aging populations, but also population growth and environmental exposures. The global prevalence rate is expected to rise from 152 to 267 per 100,000 people. Men are more frequently affected, and the steepest increases are expected in the middle-income countries. To begin our dive, let me ask, what exactly is Parkinson's disease, Dr. Olga?
Sure. Parkinson's disease is a progressive neuron system disorder that affects movement. The hallmark of the disease is the degeneration of neurons in a region of the brain called the substantia nigra. Those neurons produce dopamine, a neurotransmitter responsible for transmitting signals in the brain that coordinate smooth, purposeful movement. By the time most patients notice symptoms, but they have already lost 60–80% of those dopamine-producing cells. But dopamine isn't the only chemical affected. People with Parkinson's disease also lose neurons that produce norepinephrine, which controls automatic bodily functions like heart rate and blood pressure. This could explain fatigue and orthostatic hypotension seen in Parkinson's disease. And let's not forget Lewy bodies, abnormal protein deposits composed of alpha-synuclein found in the affected brain cells. Their role is still under study, but they might disturb the cell's protein disposal system and contribute to neural death. Some researchers believe that inflammation and oxidative stress also play a role in this degenerative process.
That's a great overview. Now that we understand the basics of the disease, let's shift our attention to what parents and families might first notice. And since understanding symptoms is key to early intervention, could you walk us through the common signs of Parkinson's disease, please?
Absolutely. Parkinson's disease symptoms can be highly individual, but they generally fall into motor and non-motor categories. Motor symptoms are as follows: tremor, subtle decrease in dexterity, decreased arm swing on the first involved side, soft voice, decreased facial expression. And non-motor symptoms include sleep disturbances, rapid eye movement, behavior disorders with a loss of normal attention during REM sleep, decreased sense of smell, symptoms of autonomic dysfunction like constipation, sweating abnormalities, sexual dysfunction, depression, and slowness in thinking, etc. Onset of motor signs may present with the following features. It's typically asymmetric. The most common initial finding is a resting tremor in the upper extremity. Over time, patients experience progressive bradykinesia, rigidity, and gait difficulty. Axial posture becomes progressively flexed, and strides become shorter. Postural instability, like balance impairment, is a late phenomenon. Those symptoms can significantly impact quality of life and may vary in severity and progression. It is important to mention that Parkinson's disease is first of all a clinical diagnosis. No laboratory biomarkers exist for the condition, and findings on routine magnetic resonance imaging and computed tomography scans are unremarkable. Two of three cardinal signs, a combination of rested tremor with rigidity and bradykinesia, must be present for a clinical diagnosis. So that is a breakdown we observe in Parkinson's disease. With those symptoms in mind, it naturally leads us to wonder who is the most at risk. So, Dr. V, could you tell more about it?
Yes, sure. Several risk factors have been identified. We need to think about age. So most cases occur after age of 60, though early onset of Parkinson's disease does exist as well. Gender. So men, as I already mentioned, are more frequently affected than women. Genetics play a role, all right? So family history increases risk, especially if certain gene mutations are present. We are going to talk about it slightly later as well. And then environmental exposure. Here we should always bear in mind the chronic exposure to pesticides, herbicides, or heavy metals has been linked to PD as well. And researchers have identified several gene mutations associated with PD, such as let's recall such as like CNCA. So this one particularly is linked to alpha-synuclein accumulation and Levy body formations. Then LRKK2 is also an important one. It's a common genetic cause of familial and sporadic PD. And there are a couple of others, like for example, like GBA, this one, there is a mutation in this gene. So there is an increase in the risk, and it can lead to early onset of Parkinson's disease, and some other ones as well. So while most cases are sporadic, these genetic insights are helping us with better understanding disease, all right? So with better understanding disease pathways, and it helps us to develop personalized treatment.
Very insightful. So after recognizing symptoms, how do we diagnose Parkinson's in the clinical setting?
So just to admit once again, all right, so we need to emphasize that diagnosis is primarily based on clinical observation. And neurologist evaluates symptoms, progression, and response to medication like levodopa, for example. And there is no single definitive test yet. That said, neuroimaging tools can help rule out other disorders. That's why we use them. So MRI and CT scans, so they are mostly used to exclude structural issues. And then dopamine transporter scan, SPECT, visualize dopamine transporter levels in the brain, offering supportive evidence of Parkinson's disease. A few years ago, a lab test called the alpha-synuclein seeding amplification assay was developed, and this test detects misfolded alpha-synuclein in spinal fluid and may offer early diagnosis even before symptoms appear. So that is pretty interesting. And ongoing research aims to adapt it for blood and saliva testing, making it more accessible in the future. Additionally, electroretinography, a non-invasive technique, can be used to detect early retinal function anomalies, reflecting central dysfunction. So that is possibly the concise overview on the diagnosis. And I guess once a diagnosis is confirmed, if it is confirmed, so the next critical question is, how do we manage and treat Parkinson's disease effectively? Dr. Olga, I'd like you to bring more understanding on this particular matter to our viewers.
Well, first of all, activities that you enjoy. Increase the release of natural dopamine and exercise. Studies show it may decrease disease progression and improve quality of life. Physical and occupational therapy to maintain mobility. Speech therapy to address voice and swallowing issues. and nutritional counseling. High fiber diets help with constipation, but protein timing is crucial for levodopa absorption. The cornerstone of the Parkinson disease treatment is pharmacological. The most effective drug remains carbidopa, levodopa, phospholevodopa, which replenish brain dopamine. However, its long-term use can lead to motor complications like dyskinesia. Other medications include dopamine agonists, MAO-B inhibitors, COM inhibitors, anticholinergic, and amantadine for tremor control and reducing dyskinesia. Apomorphine is a dopamine agonist. When medication becomes less effective, surgical options are considered, like deep brain stimulation, when electrodes implanted in specific brain areas help regulate abnormal signals. Focused ultrasound, a new non-invasive technique for tremor management. Treatment also includes lifestyle interventions. Each treatment plan must be personalized and adjusted over time as symptoms evolve.
That's an excellent summary.
There are the tools that we can currently use, but also bring us to an exciting part of the conversation, the future of Parkinson treatment. We have come a long way in understanding Parkinson's disease, but research is key. So, what advancements are on the horizon?
Well, we should say that from Japan to Europe, from Africa to the Americas, researchers are coming together to an unprecedented global effort to fight Parkinson's disease. For example, in Europe, the PD-MitoQUANT project is unlocking how energy failure in brain cells caused by damaged mitochondria contributes to the disease. In the UK, Tracking Parkinson and the UK Biobank are helping predict who gets Parkinson and how fast it progresses. It is pretty interesting. Across Asia, major brain projects in Japan and in China are using AI and advanced brain mapping to detect the disease earlier than ever. And globally, the GP2 genetics program is gathering data from over 70 countries, helping uncover hidden risk factors in underrepresented populations. And this isn't just research, it's a revolution. And one of the most promising breakthroughs in Parkinson research is stem cell therapy as well. It's using lab-grown cells to replace the dopamine-producing neurons that degenerate in the disease. These cells can be implanted and they engraft in the brain, where they may reconnect with the existing neural circuits and restore lost function. Early clinical trials are already showing encouraging results. At EWBG centers worldwide, we've seen real-world success using stem cell therapy combined with some organ-specific targeted peptides and supplements as part of the integrated protocols. We revealed these protocols partly in the previous video about Alzheimer's disease, and you are more than welcome to watch it for more background. We have shared several of the most inspiring cases on the PD treatment online in YouTube. And you will find the video links in the description below. So if you or someone whom you know is facing Parkinson, you're always welcome to reach out for advice. Help is possible, and it starts with you staying informed. However, the stem cell treatment is just one piece of the puzzle. Cutting-edge science is also exploring gene therapy to fix some mutations like GBA and LRKK2 at the source, immunotherapy to help clear harmful protein clumps, and wearable technology with AI, tracking symptoms and treatment response in real time, turning data into precision care. But with all these breakthroughs, we must also remember the importance of community and care. Dr. Olga, as we wrap up, one essential question remains. How can individuals and communities better support people living with Parkinson's?
Well, support can come in many forms. Educate yourself and others about disease. encourage involvement in clinical research and trials. Other emotion and physical support to both patients and caregivers. Create accessible environment that support mobility and independence. Advocate for policy and funding to ensure equitable access to treatment and services. Let's also remember to prioritize mental health. Parkinson is not just a motor disorder. It touches every aspect of life. Support groups, therapy, and social connection make a huge difference.
Yes, exactly, Dr. Olga. And to everyone who is watching us, thank you for joining us in this European Wellness Health Theories episode. We hope you found today's discussion on Parkinson both educational and at the same time empowering.
And don't forget to like, subscribe, and share. More insightful topics are coming soon. Until then, stay well and stay curious.
Thank you so much.
Thank
See
you.
you.
See you.